from KBIA and the Reynolds Journalism Institute. On air and online, this is Intersection.
Hello and welcome to Intersection, where people and ideas meet online and on KBIA. I'm Ryan Famuliner. Starting tomorrow, Missourians will be able to sign up for individual health insurance through an online marketplace as part of the Affordable Care Act, which many refer to as Obamacare. By visiting these online healthcare exchanges, folks can choose from a variety of options in 4 different classes. Enrollment continues through March of next year. For some people, sifting through the different plans can be a bit overwhelming. Today on Intersection, we'll break down the different options and find out how the Affordable Care Act affects you. Joining me in studio, Stephene Moore is the Region 7 Director for the U.S. Department of Health and Human Services. That region covers Missouri, Iowa, Kansas, and Nebraska. Stephene, welcome to the show.
Thank you.
Thomas McAuliffe is a policy analyst for the Missouri Foundation for Health. That's a nonprofit that aims to improve the health of Missourians. Thomas, thanks for joining us.
Thank you.
Jeremy Milarsky is the Navigator Program Manager for Primaris Healthcare Business Solutions. He's tasked with overseeing a team of navigators to help guide consumers through the new exchange. Jeremy, thanks for being here.
Thank you, Ryan. It's a pleasure to be here.
And joining us by phone is Jean Leonatti. She's the CEO of the local chapter of the Missouri Association of Area Agencies on Aging. That statewide group, along with Primaris, are the 2 organizations receiving federal money to run Navigator programs. Jean, thanks for calling in.
Thank you for having us.
Sure. We'd also love to hear from you in our audience today. What questions do you have about the Affordable Care Act rollout in Missouri? We want to know. Give us a call at 573-882-8925 or email intersection@kbia.org. You could also tweet at intersectkbia. So obviously today, out there in the rest of the world, there's going to be a lot of news coverage about the threat of a government shutdown as Republicans push in the U.S. House to delay the implementation of the Affordable Care Act. And we're going to let everybody else cover that today. So for this show, we really want to focus on the rollout scheduled to start tomorrow and the implications here in Missouri. So maybe, Stephene, probably good to start with you. How prepared are we in Missouri for the start of this rollout?
Well, Missouri, as your viewers and listeners may know, is a federally facilitated marketplace, meaning that the people of Missouri, through their elected officials, chose to let the federal government run the marketplace. So we are ready to have that start tomorrow morning.
Okay. So, Jeremy, maybe you can help us. What starts tomorrow? What? Again, it's the enrollment period, right?
Yes, correct. Beginning tomorrow, people will be able to log into healthcare.gov and enter their information, create accounts, and choose from a variety of qualified health plans for people who are eligible for the marketplace, mostly the uninsured, people who aren't on Medicare, people who don't have affordable insurance with their employer and aren't on Medicaid.
Right. And again, you and Jean, who we have on the phone, are working with these navigators. Can you explain a little bit about what they're going to be doing and are they prepared for tomorrow?
Navigators are federally funded counselors and educators who work to help people navigate the marketplace. We provide one-on-one counseling with people who are working on healthcare.gov. Typically, it's people, they come into the office and we walk them through the process, answer any questions they may have, explain to them how health insurance works, and just give them unbiased assistance. We don't sell insurance, and we present your options. We don't even recommend anything. We just say, this is what you have.
Right. And so, Jean, how do you feel the planning process and I guess training of these new navigators has gone on your side?
Well, as we say, everybody's paddling as fast as they can. We have had our people going through the federal training and getting their certificates. And then in Missouri, we have to go through an additional step in that we have to be licensed in Missouri. So we are getting all of that paperwork done. We already have some navigators who are ready to go, but certainly within the next 2 weeks, we'll probably have a lot more because it's just a process of getting through some of this paperwork that we have to have in place.
Okay. So how many, Jean and Jeremy, maybe you can both help with this, how many navigators do we have now and how many more are we planning to hire, as you're saying?
Well, for our organization, we have 70 that are active and have begun the training. We have, as of this morning, 35 that have completed the training, and 26 have been certified. And an additional, as of right before the show, our 5th navigator has obtained their state license, and this process is ongoing. So we're working closely with the Department of Insurance. When we have a bunch of license applications that are going down at once, we make sure to give them the heads up so that they can make things more efficient. And we do expect to have quite a few more in the next couple of weeks, as Jean said. Now, another thing I would like to add is that one-on-one assistance just doesn't only come through the Navigator program. There are also nonprofits and healthcare organizations that have voluntarily, without federal funding, gone through the training and become counselors.
Okay. And then Jean, what are the numbers on your side?
Well, on our side, statewide, we hope to have 95 navigators by the time this process is all done. Myself, I have Central Missouri. We have 19 counties. We will have about 20 navigators. I have 4 of them right now who have their Missouri license and their federal certification. I probably have another 5 or 6 that have their federal certification, and we're going to submit their Missouri license information today or tomorrow.
Okay. So those numbers we're hearing, 95 and 70. Stephanie, do we think, is that enough for Missouri?
Well, I think we can always use more, and the goal is that we continue to do this. A very important piece, or 2 important pieces. One are the certified application counselors that Jeremy suggested were also folks who are not funded federally, but they are volunteers, more or less, out there who've taken the training, who know what to do to help guide people as well towards making a choice for themselves. And a very important piece of this is we really want to put out here for everyone is that this starts tomorrow. This goes until March 31st. So this is not a sprint. It's a marathon. People don't have to do anything tomorrow. They can just chill out, see what's going on, and then in a week or so, get into the healthcare.gov website, see what's out there, see what works for them, take it home and visit with family about it or friends, and proceed.
Okay. Thomas, you've been sitting here patiently as we've gone over these numbers, but so why is it such a big deal, these navigators and the role they're going to serve as we start this open enrollment?
Can I jump on something the director
absolutely.
said? So just last week I needed a new driver's license, and I drove by the DMV at 8:45 in the morning, and there was a line out the door. I went home, had a cup of coffee. I went back at 10:30, and I was the only person in line to get a driver's license. And that is something I've started. I've done over 200 community meetings talking about the Affordable Care Act, and I've started to say just what you were saying, Director. You know what? Maybe go online tomorrow, but wait until Jeremy's had a month to do lots of applications. What's the matter with November 1st? What's the matter with October 20th? It's a good time. This is the first time, to answer your question, this is the first time we're really going to see what the Affordable Care Act is about. It's been a lot of words for a lot of people. And you think back to when Roosevelt passed the Social Security, and it was unpopular and people didn't like it until they started getting checks. Starting tomorrow, you are going to be able to go to a website. You are going to see Obamacare, the Affordable Care Act, in reality. It is going to have options for you, and it is going to begin addressing some of the health problems that you have, i.e. pre-existing conditions not allowing you to purchase insurance. This is a very important day in American history for many different reasons, not least of which these exchanges are an opportunity for affordable insurance and for Missourians to finally see the Affordable Care Act. And while the other news outlets may be covering the closing down of our government, the Affordable Care Act doesn't close down. Those things will happen tomorrow, regardless of what happens in D.C.
Okay. I want to take a moment to remind our listeners that this is Intersection, a program of KBIA and the Reynolds Journalism Institute. I'm Ryan Famuliner, and today on the show we're talking about the rollout of the Federal Affordable Care Act, which is scheduled to start the first open enrollment period tomorrow. We're talking about how the enrollment system will work and the implications here in Missouri. Joining us in studio, Stephene Moore is our region's director for the U.S. Department of Health and Human Services. Thomas McAuliffe is a policy analyst for the Missouri Foundation for Health. Jeremy Milarsky is the Navigator program manager for Primaris Healthcare Business Solutions, and Jean Leonatti is joining us by phone. She's the CEO of the local chapter of the Missouri Association of Area Agencies on Aging. Jeremy and Jean's organizations are the 2 in Missouri receiving federal money to run Navigator programs. And for you in our audience, do you plan to sign up for an individual plan in the healthcare marketplace? What factors are you considering? Give us a call at 573-882-8925 or email intersection@kbia.org. You could also tweet at IntersectKBIA. We'd like to remind those of you that you can watch Intersection as streaming video online during our live conversations every Monday afternoon at 2 at kbia.org. You can watch that video and join our online chat by going to kbia.org and scrolling down to the link for Intersection. Again, that's Mondays at 2 online at kbia.org. And as you mentioned, the we have an extended rollout or extended open enrollment period this year, correct? So what's it going to be next year, I guess? And we've got those deadlines as well. What's the significance of that March versus there's January is when these policies can actually start, correct?
It is. Maybe the director would answer that better than I do.
Well, as long as someone is enrolled by December 14th at midnight, before December the 15th, that person would be eligible for health coverage January 1st, 2014. But we have until the end of March to actually fulfill our requirements to be insured people. So we have until March 31st to get insurance. After that, it will follow, I believe it's, and I'm a little fuzzy on the dates, I'm sorry, but it's like first or second week of October through the first week of December when you will be able to enroll again.
Which happens to coincide with Medicare.
Exactly.
It will do the same Medicare schedule for enrollment.
I think it's October 15th to December 7, and that is for people on Medicare Part D, the prescription drug benefit under Medicare. That's their open enrollment every year.
It is also important to note that if you have a life-changing event, a birth or a divorce or a change, you can go to the exchange or the marketplace and enroll then. When the law was first rolled out, the idea was that you could enroll at any time. And that created all sorts of administrative headaches as well as headaches to people finding out that they had cancer and then going to purchase insurance after they were sick. But these enrollment periods are just not meant to be onerous or mean. They're meant to make the exchanges function so that you get as many healthy people as you do people who might use a little insurance as people who use a lot of insurance. When you think about it, you need all types of those individuals, but insurance companies are hoping to get people who don't use the product, and that's what these enrollment periods are about.
Right. This might be a good time to kind of jump into some of the nitty-gritty here, talking about the actual available options. As you said, Thomas, we're going to start actually being able to see what's available. Obviously, this information is already out there as well, but maybe people may not know. So there are 4 different classes of plans, right? Could you all talk a little bit about that and tell us what the options are?
Well, they're named after metals. There's bronze, silver, gold, platinum, and they refer to the actuarial value of how much, on average, of your healthcare costs are paid by the plan. So a bronze plan covers about 60% of your healthcare costs, and a platinum plan covers about 90% of your healthcare costs. And there's a bit of a balance there. Bronze plans are going to tend to have lower monthly costs, and platinum plans are going to tend to have higher monthly costs. Bronze plans might be a good fit for someone who is generally healthy and maybe goes to the doctor 2 or 3 times a year, whereas a platinum plan might be a better fit for somebody who lives with a chronic condition such as diabetes or heart disease. It's also important to keep in mind that all 4 classes will have to have essential health benefits that are offered no matter what. In order for an insurer to participate in the marketplace, they have to offer these. They include pediatric vision and dental, well woman visits, preventative care, and that's a big one because when you consider the crisis we have in healthcare costs, preventive care is probably one of the better ways to address that. The reason why healthcare costs, one of the reasons why healthcare costs balloon is because people wait till the last minute, they get very, very sick, and they end up getting treated in the ER. Those preventative benefits are designed to be, in most cases, free, and to get people getting checkups at least once a year.
I think it might be interesting to note, Jeremy put his finger on it, and all the time people are saying, well, if I pay more, if I get this platinum plan, will I have more benefits? You don't get more benefits. The question is not the benefit package. The benefit package is going to be the same for the carrier that you choose. So if you choose the Blue Cross Blue Shield plan or any of the other carriers, they're going to offer the same benefits. The question is, per Jeremy's observation, how much risk do you want to take? Mm-hmm. So do you want to go with this bronze plan and maybe take that 60% actuarial value, or do you want to go up and address the 90%? There is a 5th category, actually, and it's the catastrophic plans, and those are for 18 to 30-year-olds. They can purchase insurance, which is not unlike the insurance that you can purchase now. And I know that there may be a lot of listeners here at the university who are going to graduate, and they say, what do I need? They need a bridge plan or a plan they can afford. These catastrophic plans do and are available to them. The problem is that they're technically underinsured, and it's a growing section of American citizens who don't have enough insurance. And that's what these exchanges or marketplaces are really aimed at, creating a standard benefit package so that it covers a majority of the people at an adequate level.
Right. And that's really one of the challenges here, right, too, is that as a navigator and trying to tell people, the goal is to get people insurance that don't have insurance currently. So really, this is not an easy conversation to understand the decisions you have to make when you're talking about insurance, right? Anybody who's ever bought an insurance policy knows you have to try to figure out what makes sense for you and what your needs are going to be. So as navigators, how much is that the focus, or is it also the focus of just figuring out how to use this system? I mean, is part of it just helping people make those decisions or understand the decisions they have to make?
Well, what you're touching on, Ryan, is a concept we call health literacy, and just basically explaining the basics of this stuff. And we believe that's a very important part of this. It's not exactly just navigating a website. It's also understanding the basics of how health insurance works, what's a premium, what's a deductible, what's a copay, and how does all this affect you and your family's budget, and what can you afford?
Right. And so a lot of that information's out there, right, too? But how are you going to do that? How are we going to do that on a person-by-person, or where can Missourians go to get that information, I guess?
Well, a lot of the basic questions, you can go to healthcare.gov now. Okay. And find out a lot of information there. The Missouri Foundation for Health has an excellent resource in covermissouri.org. Basic information about health insurance, how health insurance works is out there.
I might bring up here now is a good time to bring up this actuarial value, and it's a complicated subject for all of us, and understanding it is tough. But as we move forward, there are some things that are going to be out of the control of the consumer, as the actuarial value. I mean, how do we go about figuring that out? It can require some significant copays or out-of-pocket from individuals as we move forward. There's a very interesting, although very difficult to read, article in Health Affairs that talks about figuring it out. And if an employer puts $15,000 in an HRA, then that brings down the actuarial value such that they may not buy really great insurance because we're talking about the cost. So as we move forward, this is a very flexible and a very fluid piece of legislation, and it's up to citizens to keep responding to both the Department of Health and Human Services, but also to their legislators and saying, listen, this law will be more effective when it gets more affordable insurance, when it reaches more individuals, perhaps even expanding the Medicaid program, when it is very flexible to the needs of small businesses. So just because this law is up and running, and it has been since 2010, doesn't mean it's a done deal. There's no period on this law. It's implemented between now 2010 and 2020. So there's still a lot of input necessary from citizens and from Missourians.
Another thing we probably should flesh out a little bit, because there's a lot of coverage and talk about these subsidies as well. Stephanie, maybe you can help us a little bit on these federal subsidies for anyone making below 400% of the federal poverty level. Can you tell us a little bit about how those work and the role that fits into all this?
Well, this is one of the times when it's so individualized. The best thing that I can say is for the person or the family to sit down and go to healthcare.gov to answer the very few questions, plug in their information, and it will help guide them to what that will be. It's a very helpful, the subsidies are very helpful for a lot of people who have found insurance unaffordable, and so this will allow them to purchase health insurance on the marketplace. But it's just one of those that's too complicated, I think, unless any of you or Jean would like to take a stab at this.
Well, I guess at most basic level, what does it do, right? It's money to help you pay for your premiums?
Absolutely.
Yeah.
It will. If you make X amount of dollars and your family size or you're an individual, however you're applying, is this, and your income is supposed to be this to your best knowledge for the next year, then you plug those numbers in and it will tell you, the calculator, which is built into healthcare.gov, will then tell you that you qualify for X amount of dollars in subsidy, which is paid directly to the insurer. It doesn't come to the individual in the form of a check that they could go shopping with, but it would go to the insurer, so then that offsets the cost. And for many people, it's coming down considerably. I don't know how often you all, or Jean, on the phone, if you've played with the calculator, but it's coming down significantly for most situations.
There was a Bureau of Labor report that said 6 in 10 folks eligible for the marketplace are eligible to pay less than $100 a month.
I would like to, bring up something, since we're in the nitty-gritty, something that's really interesting in my book, is that there's a Kaiser Family Foundation study out there that says 50% of all the people who are in the marketplace will receive a subsidy. And, we get lots of critics when we do town hall presentations that say, who's paying for this? Isn't the federal government, i.e. me, paying for this? And I submit to them something completely different. Right now, insurance companies argue with hospitals and individual providers to keep their costs down. And they essentially are the kind of check to cost, other than Medicare. But the problem is that these insurers don't have the leverage, the crowbar, so to speak, to bring down costs generally. But because of these subsidies, the federal government is subsidizing insurance companies. And insurance companies are bound by an 80-20 rule, which says they have to spend 80% on care. So if the cost of care continues to go up, they don't have any sunken reason to actually go after doctors and or the means to bring down hospital systems costs. This law takes that power out of insurance companies and at the same time asks hospitals to get bigger. I submit to you that these subsidies are going to have the largest impact on healthcare in America for reasons that we're not thinking about. I believe that they will, over time, put the government in a position of having to talk to providers about cost, about what an MRI costs. Why is an MRI so much more expensive in Arizona than it is in St. Louis? And then the federal government is going to have to be in this position. And I would just say, for those people who say this will never happen, I'll say we already do it. It's called the VA hospital, and it's called Medicare, and it has good outcomes, and it brings down administrative costs. So there's a whole other aspect to these things other than just getting people insurance.
Ryan?
Yes, Gene.
I'd like to add about the situation of the subsidy for people to think about it a different way. My employer offers me health insurance, and it pays a portion of my premium to receive that health insurance. So I'm getting a subsidy. My subsidy happens to come from my employer. Other people are not able to get health insurance through their employer. So when they go on this website, they might be able to find subsidies that the government is offering them that is very, very similar in concept to the subsidy that I'm getting from my employer. So it should never be thought of in terms of the only people who are getting a subsidy are the ones who are on the marketplace, because that's not true.
And take a moment to remind our listeners that this is Intersection, a program of KBIA and the Reynolds Journalism Institute. I'm Ryan Famuliner, and today on the show, we're talking about the rollout of the Federal Affordable Care Act, which is scheduled to start the first open enrollment period tomorrow. We're talking about how the enrollment system will work and the implications here in Missouri. Joining us in studio, Stephene Moore is our Region's Director for the U.S. Department of Health and Human Services. Thomas McAuliffe is a Policy Analyst for the Missouri Foundation for Health. Jeremy Milarsky is the Navigator Program Manager for Primaris Healthcare Business Solutions. And Jean Leonatti is joining us by phone. She's the CEO of the local chapter of the Missouri Association of Area Agencies on Aging. Jeremy and Jean's organizations are the two in Missouri receiving federal money to run Navigator programs. And for the young people in our audience, do you plan to purchase insurance through the healthcare marketplace? Why or why not? Give us a call at 573-882-8925 or email intersection@kbia.org. You could also tweet at intersectkbia. One other thing to mention about while we're still kind of talking about those federal subsidies, Stephene, maybe you can help us about what would you recommend to folks who are not going to make enough money to qualify for those federal subsidies, but also don't qualify for Medicaid, since we haven't had that Medicaid expansion here in the state? We can talk more about that too.
That's an entirely other discussion, the expansion of Medicaid
Sure.
in the state of Missouri. And I will start by saying that the door for that, in regards to HHS in the state of Missouri, the door is still open for the people of Missouri to make the decision that they want to expand Medicaid. You can visualize that we have the money there that says Missouri on that bag, and we're ready to give it to your state, to the state of Missouri, and let that help with the folks who need that. Unfortunately, without the expansion, there are going to be a significant number of people within the state of Missouri who are going to fall into a gap. They just make a little bit too much to qualify for Medicaid, and yet they're still not affluent people. They're not able to work into their budget purchasing all of the insurance plan, the marketplace. those folks are going to have to rely on faith-based groups to help them out, as well as with our safety net clinics that we have here in Missouri.
So Jeremy, Gene, what are you going to do when these people come and are asking your navigators what to do?
Well, the only silver lining, if you can even call it that, to that group of people is they are immune from the penalty. So if you're eligible for most people, if they're eligible for the marketplace and they choose not to buy a plan, there's going to be some kind of tax cost to them in 2015. Either they're going to get less of a refund or they're going to owe them the government money when they file their taxes. For those people that fall in this gap that we're talking about, they are not affected by that. Not the best solution, obviously, but at least there's that. So we recommend that they file a marketplace application so that they at least have something on paper that says we don't qualify for these subsidies, but we're immune from that penalty.
Gene, anything to add to that?
No, other than what Stephanie talked about also, we would be able to refer them to some of the federally qualified health centers who could provide them some health care. But it is a very difficult spot to be in here in Missouri in that gap, and if you're a counselor having to work with somebody and then deliver that message to them that they're not eligible because of a decision that's been made in Missouri.
Right. And so, I don't know, I guess, Thomas, you're the one that hasn't weighed in on this yet, but how realistic is it going to be that they'll find care and this gap? What are your concerns there?
Completely unrealistic. I don't mean to knock on the silver lining, but we're talking about the uninsured. In fact, I feel for the Jeremys and the Jeans this week because we're saying, come to the exchange. This is for you. This is an opportunity. And we're talking about people who are, we have 825,000 uninsured in Missouri. The statistics suggest 50% of them will go to the exchange. That other 50%, they are either people who are eligible for our current Medicaid program and haven't enrolled, or they're not eligible at all. Life doesn't change much for them. And that really is the kind of tragedy of what we're talking about. That person making $6 an hour, who's your local mechanic or your brother-in-law or your sister-in-law, they cannot avail themselves to any resources to improve their health and welfare as a result of this law. And that's not a result of the federal government. It's the result of a decision made by our state legislators. The upside is this, is that last week the Senate had a hearing on how to deal with this issue, to address this issue. There is another hearing next week. Our state legislature is dealing with how to transform Medicaid, to look at options. But ultimately, these are the poorest. They are not the sickest. They are the poorest, and they are in most need of assistance, and there is nothing for them other than some of the things they've heard most of their lives.
We're going to have to take a short break. I want to remind our listeners this is Intersection, a program of KBIA and the Reynolds Journalism Institute. Today on the show, we're talking about the rollout of the Federal Affordable Care Act, which is scheduled to start its first open enrollment period tomorrow. Joining us in studio, Stephenie Moores, our Regents Director for the U.S. Department of Health and Human Services. Thomas McAuliffe is a policy analyst for the Missouri Foundation for Health. Jeremy Milarsky is in studio, and Gene Leonatti is joining us by phone. Those two represent the two organizations in Missouri receiving federal money to run Navigator programs. I'm Ryan Famuliner. We'll be right back after a short break.